Hello, my name is Dr. Kerry Kalis. In this session we are going to talk about rhinoplasty surgery, or ways to improve the nasal appearance. What are the common reasons for rhinoplasty surgery? Usually it is a bump on the nose, a nose that is too big, a nose that is too wide or too long, an overprojected nose, traumatic deformity, and these can be associated with breathing difficulties. Let's take a look at some examples of rhinoplasty. This first patient was concerned that the tip of her nose was a little wide. In the right hand picture, you can see the tip has been narrowed. In her side profile, the overall projection of her nose has been modified and reduced. This patient has concerns for the width of her nose. In the post-operative image, you can see that the tip has been reduced in width, and in the lateral view, her profile has been changed to take away the bump and the hooked nature of her nose. The next example shows a male rhinoplasty. The bump has been removed, the nose has been shortened. In the front view, the tip has been narrowed. In this case, this patient's nose was narrowed and shortened. In the side view, the hook and the bump have been improved to produce a far more pleasing profile appearance. This case is a corrective procedure after a previous rhinoplasty performed elsewhere. In the preoperative appearance, the tip is deformed and the dorsum of the nose is irregular. In the right hand images, the dorsum of the nose is smoother and the tip has been reconstructed. This is the same patient taken in profile. The residual bump has been removed and the new profile is far more pleasing. This gentleman wanted a rhinoplasty to improve his breathing, his tip appearance and the bump on his nose. The bump is visible in this side view. This patient wanted a reduction in the width of the tip of her nose and also the bump be removed. The post-op lateral view shows a more pleasing appearance in the profile view. In this example, the patient's nose appears overprojected. In the right-hand image, you can see that the projection has been reduced. The nose is smaller overall. In this gentleman's nose, he wanted the bump removed, and in this case, bump removal and shortening of the nose. You can see in the post-operative image on the right-hand side, the nose appears smaller overall. What are the considerations when preparing for rhinoplasty surgery? Take 7 to 10 days off work or school. The splint stays in place for up to 7 days, so this may curtail some public appearances. Skin-coloured tapes are then often placed on the nose after the splint is removed. Bruising may be present for anything up to 10 to 14 days. It gradually improves day by day. The swelling can stay present for anything up to 6 months. One must be very patient waiting for the final result of rhinoplasty surgery. Let's talk about the risks and complications of rhinoplasty procedure. There can be bleeding or bruising, infection, numbness of the nasal tip, temporary nasal airway obstruction, contour irregularities, in other words, the skin may appear irregular over the nose, there can be scars, and there can be subjective dissatisfaction. Most of these problems are rare if they occur at all. Most irregularities will resolve by themselves. It can take up to 6 months for the final result to take place. Risks of surgery also involve risks of general anaesthesia. There can be drug reactions, allergies, prolonged nausea, and respiratory problems. Your anaesthetist will detail these risks with you. Thank you for taking the time to listen to this presentation. Please don't hesitate to contact either myself or my staff should you require further assistance.